Code. So for the sake of the recording, this is the Board of Health meeting of August 2025. There are four of us here. Myself, Catherine Hilton, Noreen Pease, Wim Levine, Garrett Simonson, and Arlene Reed is absent. I have a thing to tell you guys, a few things. One of them is that a certain person in town, maybe not the person you're thinking of, has pretty much declared himself or appointed himself the open meeting law police. And he's going around and challenging different boards and committees with which he has nothing to do over irregularities in what I have to say are the most trivial parts of the open meeting law. So in all the minutes are supposed to say who made the motion and who seconded it, even if it's a motion as trivial as adjourn the meeting or accept the minutes. And there are a number of other things that we should do. And I have to assume that it's only a matter of time before he starts coming for the Board of Health, because he's on a mission, although I don't really understand what it is. So I'm just going to have to be very careful about how I take the minutes and how we run the meeting. So bear with me and also help me out if I forget. Okay.
Sure.
Okay. And I'd better take some actual notes. No, maybe I'll just put them on the computer. Hang on a moment. Okay, I am not really prepared with the minutes. I know that I have sent minutes out for the last couple of meetings, but I kind of don't have them in front of me, and so I would like to defer them again if nobody has any objection to that.
Wim Levine has no objection.
Thank you, Wim. Hearing no objections, I'm just going to put that off for a future meeting, and then we'll catch up on the whole minutes thing. Another thing that I have to tell you is I went on a site visit last week to 14 Great Pines. I think we talked about this at our last meeting. Their well went dry there, following the drilling of a new deeper well right across the road. I've talked with Ezra Cushing about it, and it's in his observation is that the water table around there is just dropping, right? And these people apparently have a shallow well, and it's dry, or last I knew it was dry, and it had been dry for weeks. So Ezra, so obviously, and those lots are tiny and strange over there in Great Pines. And so Ezra asked me to come and look at it with him. And it will require a certain number of variances to our well regs. It's a little too close to the road, but the road is like nothing because, you know, who drives there? It meets, it's going to be more than 50 feet from the well, or rather from the septic system, as far as we can determine it. However, as Ezra and I were walking the site and talking about this, the owner came out and told Ezra that he was going to have to back off on this a little bit. So I have to think that there is a problem with financing that he had to figure out first. So we don't actually have a well permit application yet. However, what I would like to do is get your agreement, get the agreement of the board that I should issue the well permit if it comes to me before we have another meeting, because I really don't want these people to have to go a single day longer than they have to without water, although it's been like a month now, and I know that there's a child in the house, and I don't really know if there's something we should or ought to or can do about it.
So what they're contemplating is drilling a deep well on the same site as the shallow one.
No, no,
Oh.
it's a new site. The existing well is actually underneath a paved driveway.
Hmm.
And because I asked Ezra about the possibility of deepening that well, and he said that that wasn't really feasible. There were all kinds of technical problems with it, and the possibility that it basically wouldn't work or would contaminate it. He said that just could not work. And besides, do we really want the well under the driveway? I mean,
No,
ick. So he had found a spot that's close, but not the same spot.
got it.
And Kat, we don't have any more money for helping out with wells or septic systems. I know we did for a while, and I think we used all that grant money
We have grant money, but that's for repairing septic systems. It's not,
only.
yeah, it can't be applied to wells. And I thought that there used to be some kind of program through FERCog for replacing wells, but I looked at their website and I didn't see anything. So I don't know if there's any kind of financial assistance for drilling a new well. And it's just conjecture on my part that the problem is financial, because the owner hasn't said anything to me at all.
Well, I think, Wim, you probably know better than I, but I think you're looking at 25, 30 grand for a new well these days, aren't you?
No,
Mhm.
I mean, it all depends on the depth, but it's not quite that much. But you should definitely count on 10 to 15.
Mhm.
Yeah.
Well, it would be a lot more if they were gonna drill the existing well deeper.
I can imagine they'd have to
Take
remove
up the driveway and then
Yeah.
replace the driveway and
and remove casing from the old well, and yeah.
Right, right. And that reminds me that they have a whole protocol that they do when they can't meet the all the setbacks of our well regs that involves a certain depth of casing, whether it's in bedrock or not, and sealing it with whatever kind of sealant they use. So I mean, they're very careful about protecting the water line. Just so you know.
Well, I think we should assist these people. I would make a motion that we go ahead and issue this permit pending, you receiving the adequate information, Kat.
Okay. Hang on a second. So Noreen is moving that we issue the permit when we get it. And do I hear a second?
I'll second Garrett.
Garrett seconds that. Okay, any further discussion?
Just a quick question. Ezra, is Cushing, did you say?
Yes,
Yeah, okay, thank you.
okay, hearing no further discussion, let's vote. Noreen,
Yes.
Wim,
Yes.
Garrett,
Yes.
Kat, yes, so it's unanimous. All right, when I get that, I will move forward as quickly as I can. And if anybody learns anything about any kind of financial support for new wells, please let me know and I'll pass it on. Noreen, you were gonna give us a report on the collaborative.
Yeah, the Valley Health Collaborative is meeting tomorrow, and neither Garrett nor I could go. So Megan was kind enough to give me an overview of basically what's happening today. Happy to say that I think the last time I talked with you guys, we were looking for a part-time inspector, and they've been able to hire someone who Megan thinks is overly qualified. She's a mom who's looking to work hours when her kids are in school, and this lends itself nicely to that. So she's going to be starting, I think, in September.
When you say inspector, what kinds of inspections is she qualified to do?
I didn't ask Megan that, so
Mhm.
I don't know. I don't know what, you know, I don't know what,
I would guess that when they call it an inspector, it's somebody who can do food service inspections, probably camp inspections, housing inspections, but I wouldn't expect her to be able to do like Title V inspections.
yeah, I don't know. Megan was actually witnessing a Title V when I spoke to her this morning, so
Mhm.
I think she and Michael, will still do that until the other two newer inspectors are up to speed on the Title
Mhm.
Vs. So, and I understand she talked to you the other day, or Michael did, about how we handle our inspections and why we do it the way we do, so.
Yeah, what Meg and I were talking about was the certificate of compliance. So,
Right.
so Mike does at present, he's acting as our agent. He reviews the plans and gives his approval, and then we issue the permit. And then when the system has been installed but not covered up yet, he goes out and does a final inspection and allows them to cover it up, and then he signs. He did not know that we had reserved the issuing of the certificate of compliance for the Board of Health. So he issued it and didn't send it to me, which wasn't good. And
After I asked him to,
right, that one he didn't. Some other things he has sent.
okay,
But so I explained to Meg that it's a very small ask, right? We want him to do what he's doing and sign it, but then send it only to me so that the Board of Health can issue it. And that's just a way of keeping control. Sometimes, not everything has been done administratively, and it gives us a little bit of leverage on whoever, on the homeowner or the installer or whoever still needs to comply.
right, no, I agree completely, and they seem to have a good sense of why we're doing it that way now, Kat, so,
Yeah, Meg seemed convinced, so
Yeah.
I was satisfied with that.
okay, good. The other thing is, Sarah is wanting to do a flu clinic again this year. I think we had one of the best turnouts in the entire state for a flu clinic. And so she's having some conversations with the school about possible dates. Kat, is this the first time you're hearing this, or did
Yes,
you?
it is.
Oh, okay. All right. So she was going to talk with the school nurse, and just about setting that up. We talked about October. That's when I think we have usually had them in the past.
Yeah, I think you're right.
And that's also good in terms of timing for, when flu season, when the flu is most virulent. So,
Mhm.
all right, well, let's, make sure we touch base with Sarah, on that. And I think we all did go, and at least we all participated. I think we did show up, and I don't think we had to do anything because, uh,
I think no, I don't think we had to do anything. I think we were helping clean up after it was
Yeah.
over, putting the chairs away and stuff,
Yeah,
but we were not part of the
no,
process. It was two nurses from somewhere else, as I recall.
yeah, they were like hired for that purpose.
Yeah.
I think, yeah.
yeah, I think there's a contract entity that does it. At least I've been to the Greenfield ones a couple of times to
Mhm.
get vaccinated myself, and they hire a company who comes in and does everything, the paperwork, all of it. So
Right, as I remember, those two women were from far away.
They
Yeah.
were, I think, the deep south or something.
Yeah, they were from
Yeah.
well south of here, I'm sure. And I don't know if they're just traveling around the country doing flu clinics or what.
And how about yeah, I think we've had some information about the Well Baby clinics that Sarah has started.
I know that she started them, but that's all I know.
Okay.
Have you
That's
heard anything?
just that it's part of our work plan. It's part of the SAFE program. It's one of the requirements.
Oh,
So all the nurses have done it, and apparently they're all really enjoying having this opportunity, and as are the, the new moms. So,
mhm. Cool.
and then the final thing think I forwarded to you today, Kat, tell me if you got it or not, was we need to sign the agreement every year as part of the, contract to be part of the collaborative, and you need to sign it and the town administrator needs to sign it.
Yeah, I thought I signed it and sent it back, but I didn't realize Haley.
That
had
was
signed it
something else I
also.
thought.
Pardon me?
I thought that was something else. We did that
Oh.
a couple meetings ago.
Oh, maybe
I
so.
could be wrong, but
Okay, well, I'll get that done.
okay, thank you. That's all I have.
Okay. What else do we need to know? Garrett, do you have anything to tell us?
So on the MAFCO front, PRCOG has issued RFPs for the projects, request for proposals for the projects for the budget period. But aside from that, it's very slow for now because it's summer months.
Right.
Yeah.
Excellent. And so what kinds of projects are we talking about?
The main project that will involve us is that we'll need to participate in a discussion-based exercise at some point. And that will involve the Board of Health recruiting emergency management and public safety to participate with us in it. But more information's to come on that. That's one of the proposals that's out for bid.
Is that like our old tabletops that we used to do?
Yeah.
Yeah,
Yeah.
okay. Because they did away with those for a couple of years, did they not?
It wasn't a requirement.
Right, that's right.
Mm-hmm.
I mean, you could still do them, but
So emergency management and public safety, just, I guess, pretty much the same thing. Since we don't really have much in the way of public safety except a few police officers.
yeah. Yeah, so
Okay. And when would this be happening, do you suppose?
maybe October. I mean,
Mm.
the challenge is they just issued the RFP.
Right.
By the time they get proposals in, because I think they're required to have a 3 or 4 week advertising period.
Mm-hmm.
I mean, we're already at September, so
Right.
it's not going to happen in October, I don't think.
Okay. That makes sense. And this is like a full board thing. It's not something that maybe you would represent us, or would we all go? What's the drill?
I think we should all go
Okay.
Yeah.
for the experience.
I think we used to all try and go to that, Kat.
Yeah, and I remember going to one. I really only remember one or maybe two. And what I remember most is that the room was so packed you couldn't really hear anything that anybody else said, even at your own table. So that wasn't ideal. But maybe they can organize it in such a way that it's not like that. But yeah, when we know, we'll plan it. That reminded me to update you on the health agent search. We had scheduled an interview for, I think, Monday the 18th, but it was postponed apparently indefinitely, because all I got was a message that it had been postponed and it hasn't been rescheduled that I know of. And I got an email today saying that a third person has applied for the position, but I know nothing about the person. I haven't seen the application or the resume or anything, so it's still pretty much up in the air. Anything else we need to talk about?
I just want to let you know that I had my final day of work yesterday.
Congratulations.
But I'm gonna let my license lapse.
Uh-huh.
So I don't think that will have an impact on my role with the board, but because I've never had to really utilize my license in any capacity here, but just so you know, I won't be a nurse practitioner after November 12th.
Okay, good to know. Thank you and congratulations.
Yeah,
Thanks.
like congratulations.
Yeah,
Um,
Wim, I thought you had retired a couple of years ago, and then I think they lured you back, is
They-
my recollection.
Exactly what
Yeah.
happened. They made me come back.
Just when you thought had escaped, they
But
caught
they
you
This
will-
and
is
brought
one
you
way to
back.
do it, let your license lapse.
Well, I chose yesterday because today my liability insurance policy expired.
Hmm.
Perfect
So-
timing.
Yeah.
Right. Right. Well, yeah, since we don't have any flu clinics or anything like that we do, it shouldn't make any difference to us whether you are licensed or not. You still have all your knowledge, which is helpful.
Fading quickly, yeah.
Right. As soon as you're retired, all erases. Right. All right. Is that all we need to talk about? It sounds like it is. Our next meeting is going to be September 3rd, I think, unless there isn't anything to do. Right, as always.
I, Garrett, will move to adjourn.
And who will second that?
Wim Levine, second.
Wim will second. Okay. All in favor, Noreen,
Yes.
Wim,
Yes.
Garrett,
Yes.
Kat. God, yes. All right.
Well,
Thank you, guys.
I just want to say to Wim, I hope you have good luck with this. I guess it's called a revision or this working.
I think it's called a Roto-Rooter job.
Yeah.
Ooh. Yikes. When are you going
Thank
to have this?
I don't know. They said at Neos, they said they were scheduling 2 to 3 weeks out, and I'd like to do it as quickly as possible if that's really what's going on.
Right.
So
Well, and I hope it doesn't turn you off from eating crab.
yeah, it already has.
Just the thought of it, huh?
All
Okay.
right.
Well, good luck with that, Wim.
Thanks.
Yeah.
I'll let you know.
Take care.
Okay.
All
Good
right.
night, all.
Night.
Good night.